Good afternoon. Welcome to Thai PBS World News Update at 1 p.m. with Tulip Nang Sompop Lao. So today we are going to, let me take this off. I think it's a little too much. Okay, sorry. Today we are going to talk about, of course, latest figure recorded today in Thailand, mostly, of course, from Samut Sakhon province. We're going to talk a little bit more about Bangkok. We're going to talk about the recent survey about the online learning from 77 provinces in Thailand. There's something to be talked about there. And you will hear more about Sputnik V COVID vaccine developed by Russia. We're just going to talk a little bit about that since the latest study published on the Lancet, the online medical journal, suggests that it is quite effective. And then we're going to talk about Maesor that asking the community to be more vigilant on strangers coming in their community since they got a whole family infected. And lastly, Phuket, private sector of Phuket wants quick self-funded vaccination so they can get back into tourism within this year. So let's see what is their proposal and how they think they're going to do it. First, start off with the CCSA announcement. Let me get to you Dr. Tuvisin's screen right here. On the screen, he was talking about Bangkok, but before we go to Bangkok, we're going to take a look at the overall number of today first. Let me see. That is the figure today. Thailand recorded 809 new COVID-19 cases today, 13 of whom are imported cases with no new fatalities. Most of the new cases are asymptomatic and brings the total of the country, this is cumulative numbers since the first outbreak, to 22,058. And there are currently over 7,100 people receiving treatment, and about 2,200 of those are in the hospitals, including 8 patients in critical conditions. The rest are in the field hospital. Now, this number you see on the screen, Samut Sakhon has seen, the new outbreak has seen so far 13,532 people, which is about 98% of the total number. 11,000 of them discovered through proactive screening, while most cases in Bangkok, which is 720 out of 802, are discovered through medical facilities walked in. So it's just a little bit of different there. Most of the cases in Samut Sakhon discovered through proactive screening in the communities, in the factories and residential area, which more than 11,000 has been discovered. But in Thailand, in Bangkok, most of the cases discovered by the person getting in the medical facility themselves. So the 13 imported cases, let's talk about 13 imported cases, are all in quarantine in several provinces. They are from Israel, Malaysia, Pakistan, United Kingdom, United Arab Emirates, United States, Russia, Ethiopia, Germany, Belgium, Spain, and France. The focus of the brief today was the proactive screening being conducted in Bangkok, especially in the factories in its nearby community, the district next to Samut Sakhon. Now we're going to go to the map. That's the map of Bangkok. The dark purple area is Bang Khun Thien, which is the district that discovered most of the infected cases. And this on the left of the screen that you can see on the west of Bangkok are the area that connected to Samut Sakhon. So Bangkok has been doing proactive screening, specifically in the factories and its nearby community in the 5 districts, Bang Khun Thien, Phassi Charoen, Bang Plat, Bang Rak, and Thonburi, with Bang Khun Thien see the highest number of infected cases at 151. Dr. Thavisin Vissanuyothin, the spokesperson, mentioned the study by National Research Council of Thailand. That's when he talked about, let me show you. That's when he talked about the study. It's a study done by National Research Council of Thailand, or NRCT, about the online learning among secondary and undergraduate students. There were 72,626 participants from 77 provinces. Over 80% are in government schools. So this is interesting because it's for the private school, you will know most of the people do online learning, but the 80% of it in the survey are the data from the governmental school. The study found that most tools used for online learning by students are mobile phone, which is over 71%, followed by laptops, about 30%, and the rest are desktops, tablets, printers, televisions, and there are 0.29% of the participants of the 72,000 that don't own any tools at all. So the data shows that over 88% of learning hours in 28 red zone districts, what you can see right now on the screen where the cursor pointing at, the red cursor, that is the number of the percentage that 28 that schools in 28 red zone districts were online. So most of them were online, were doing online learning. And the overall education system was, in the whole country, 48.44% online. So we can say that for most of the country, we are doing half and half online, half offline learning. And about 30% of the schools used mixed system. So between on and offline, about 21% were 100% offline. So there are still some schools that still depending on offline facility with various reasons, maybe not enough supplies, or they don't really have severe case of outbreak situation. It still permit them to do the offline learning. Dr. Thavisin said that there are chances that schools in different parts of the country might have to be closed again and reopen again temporarily throughout this year because it's depending on the outbreak situation in each area. The online learning will be a tool to help schools. He told the public to adjust themselves and has to get familiar with the system. Dr. Thavisin at the end reminds the public, because it's very close to Chinese New Year next weekend, so he asked the public to don't forget to keep social distance, wearing masks, washing hands during the Chinese New Year holidays. He didn't say that you cannot do the family gathering, but he asked everyone to try to reduce the risk of getting infected, especially the elderly that he think might be better off using virtual meeting apps like all these video calls instead of meeting in person. And he even mentioned, during Chinese New Year, traditionally people like to give a gift of cash to the younger family members. He suggests maybe do cashless transaction online this year. It's a safe way. You don't get infected. It reduces the touching surface, and it's safer for everyone. So that's what's on the press briefing at 11:30 today by Dr. Thavisin Vissanuyothin. Let's go to the next topic. We gonna talk about Sputnik V, the COVID vaccine that developed by Russia. Let me show you the picture of it. We have the picture of the Sputnik vaccine there. That is the Sputnik vaccine. Russia has been developing its own COVID-19 vaccine and was a big headline news since it was out fairly quickly compared to other vaccines last year. So though it was the first, the public had doubts about its efficiency. However, the latest publication on the medical journal, The Lancet, might help answer some of the questions. The article stated that from 20,000 participants in phase 3 trials, 2-dose Sputnik V vaccination offered 91.6 efficacy against symptomatic COVID-19. And that is high because with the CoronaVac by Sinovac, the vaccine developed by China, it's a little over 50%. And AstraZeneca, the one that we have been talking about a lot lately, is about a little over 70%. So an independent Lancet commentary by Ian Jones of the University of Reading and Polly Roy of the London School of Hygiene and Tropical Medicine said that the development of Sputnik V vaccine has been criticized for unseemly haste, corner cutting, and an absence of transparency. But the outcome reported is clear, and the scientific principle of vaccination is demonstrated, which means another vaccine can now join the fight to reduce the incidence of COVID-19. The study did a randomized, double-blind, placebo-controlled phase 3 trials at 25 hospitals and polyclinics in Moscow, Russia. They included participants aged at least 18 years old, no infectious diseases in the 14 days before enrollment, and no other vaccinations in the 30 days before enrollment. So there you go. So over 90% efficacy. It sounds very good right now. But whether it's going to be in Thailand, it depends on whether anyone will think about importing them and then submit the paper or document needed to FDA Thailand. And then when they get approved, of course, it can be distributed in the country. And that's the Sputnik V. Sputnik V is the COVID vaccine developed by Russia. It's named like spacecraft or satellite. Anyway, let's talk about Massot. Okay. Let's talk about Massot. Massot, it's asking people in their community to be vigilant and to monitor strangers in their communities because they have quite big number of new cases. Health officials in the province of Tak are seeking cooperation from members of the public to identify strangers, especially illegal migrant workers, and to report them to authorities after 7 members of a Myanmar family were found to be infected with COVID-19 in Massot district. The discovery of the infections, including a 78-year-old, has prompted health officials to conduct proactive screening of more than 1,000 people in the sub-district. Suk Upakara, who is the chairman of the Tak Islamic Committee, also urged community leaders to ask people to be vigilant and to observe basic safety guidelines strictly. According to Facebook page of doctor at Massot District Hospital, 10 COVID-19 cases have been recorded as a result of proactive screening, 8 cases in Simoy Market and 2 in Pajaran Market. So they are still doing proactive screening. We might see more numbers in this 1 or 2 days. And that is the news from Massot. Before this, Massot has been the news because there are some Thai people that has been working in Myanmar illegally, sneak out and try to sneak back in through the natural channel. And they found to be infected. So the Thai government and Myanmar government were having an agreement that if Thai people wants to come back, even though they are there legally, they just need to pay a small fine for their illegal stay or overstay or whatever it is before they get back in Thailand through the official channel. So they can be in the state quarantine facility, get into the system. Now, let's go to Phuket. I know you know how Phuket look like, but just gonna show some photos in case you missed it. Here's a photo of nice sea of Phuket. Maybe you'd rather see the photo of the ocean. The reason that we are talking about Phuket because the private sector of Phuket wants to proposing the government that they will do self-funded vaccination program so they can reopen for tourism before the end of the year, say in October before the high season started. The private sector on Phuket has joined forces to push for self-funded vaccination program to inoculate up to 70% of its population in the hope that the resort island will be able to reopen to foreign tourists on October 1st, which is the start of the annual tourism season. Representatives of tourism-related businesses, which include the Phuket Chamber of Commerce, the Provincial Tourism Industry Council, the Provincial Industrial Council, and Southern Thai Hotels Association, the Tour Guides Association, that's a lot of organizations, the International Schools, and the Private School Association met recently to discuss the tourism-related situation during the pandemic and the prospects of vaccines as a key element in reviving the devastated economy. Phumikit Raktangam, the president of Tourism Business Association, said that all the tourism-related businesses agree that Phuket must reopen on October 1st to foreign tourists who have been vaccinated. Otherwise, many businesses in Phuket will go bankrupt. Their only hope are the vaccine, he said, adding that the private sector wants answers from the government to these questions. First, is it okay that vaccinated foreign tourists need not quarantine upon arrival in Thailand? And which vaccines are acceptable? Second, regarding the distribution of vaccines, which groups of people in Phuket will get the vaccines first? And last question, is it possible that local administration organizations in Phuket can procure vaccines with their own funding, or for the private sector to secure their own vaccines? Phumikit said that the private sector in Phuket envisages that up to 70% of the population of the island, except those under 18, should receive 2 doses of vaccine within September, with a 1-month period of herd immunity to develop before reopening the island to foreign tourists. Sarayut Maulam, the president of the Tourism Industry Council, also said that private entrepreneurs in Phuket need only 2 things from the government. The first one is moral support, and the second one is the policy support. So Phuket can recover from the impacts of the virus and stand on its own feet again. Gongsak Phupongsakorn, the president of the Southern Thai Hotels Association, also urged the government to respond quickly to their questions, noting that time is important and cannot be wasted. Otherwise, all the financially troubled hotels and properties on the island will be scooped up, and fire sale prices by foreign investors. That is an interesting point to mention. And this actually coincides with the news reported a couple of days ago by the tourism ministry that they are thinking about proposing the government that will allow the foreigner that has been vaccinated, fully vaccinated, come in Thailand without being quarantined for 14 days. We don't know yet how it's going to go. It sounds like an interesting idea, but I think there is a lot of detail to be ironed out. What kind of vaccine, what kind of document and paper required that we would make sure it's not easily imitated or make up some false document, and what country we will allow it in. It will be very interesting. And we just have to keep our eyes on this vaccine story. It's developed pretty quick, especially when you hear the news about Sputnik V vaccine from Russia that we haven't talked about for a while, but now it seems like it can coming into play. But I think all in all, we have to see at the production ability, capacity of each vaccine manufacturer, how soon they can manufacture, how much they can export from their country of origin, and how fast. So we just have to see, because we are not the only one in the world that want these vaccines. And that's all the news I have for you in this edition of the Thai PBS World News Update. You can follow us at these outlets. We have website thaipbsworld.com. We have Facebook, Thai PBS World. Just search for Thai PBS World on Facebook. You're definitely gonna find us. you're definitely gonna find us. YouTube channel, Thai PBS World. We have all the video clips and all our live program. We always upload it on the YouTube. And also we have Twitter that you can follow the news on Twitter as well. It's quite active, and some of the photos or some of the information we posted on the Twitter, we're not going to post it on Facebook or website, just because it's a different kind of platform and it's worked differently. But yeah, if you want to know more about news in Thailand, not just COVID-19, the political news, food and travel, livelihood, laws, in-depth analysis, we have all those on our website. You can go check it now. And we will see you again at 7 p.m. Me with Nat Bunnang at the Thai PBS World tonight, give you update again on the COVID-19 outbreak situation in Thailand. And if there is other big news going on by then, we will definitely get you updated on it. สวัสดีค่ะ